So I had an experience where I had an injury to my left shoulder. So I was playing a pickup game of basketball, injury to my left shoulder, and I went to one of the university hospitals in the Chicagoland area with terrible pain into my arm, from my neck down into my arm. And I was probably about 19 to 20-year-old at the time. And the only options that were given to me were surgical. I had a physician that saw me that offered spine surgery, another physician that saw me within about 15, 20 minutes, recommended shoulder surgery, and there was no other options that were given to me. And subsequently, I had left, rehabbed it on my own. It ended up being a shoulder issue, not a spine issue. And I went through a couple of interventional procedures at the time, as well as rehab. And to this day, 30 years later, I've never had surgery and I'm pain-free. So the thought was back then is that it was interesting that the only options to me were either to live with it or surgery. And the recommendations were surgery at that time. And I thought that there was a big gap in terms of what was being educated to the patients as options of treatments that were outside of major surgical interventions. And at that time, the field of pain management did not exist. And that's what sparked the interest. And then as I went through medical school, residency, during residency, a lot of options for pain management were just narcotic pain medication management, not the interventional options that were there. And so that was kind of where my curiosity was. And obviously earlier in 2004, 2005, so about 20 years ago when I started my practice, that was the focus, is trying to identify sources of where the pain is coming from and offer conservative and interventional, procedural, or minimally invasive options to kind of identify, treat, and get the patients back to a full kind of functional quality of life without going through major surgical intervention.